continents that are not really doing any better anyway. But when you look at our own country, which is where we're driving to, you know where we are. So like I said here, the best form of defense against COVID-19 disease is testing and continuous testing, and not just continuous testing, but aggressively. So we need to know that this is the only way we could actually immediately arrest COVID-19 going forward. From what I've explained from the beginning of this presentation, you agree with me that to get a drug at this moment is going to take a little while. To get a vaccine, again, the least we could get maybe 18 months, or if not more, 24 months. That is just speculation. It's not guaranteed that in 18 months, we're going to have a vaccine. So the real thing we need to do is testing and continuous testing. Then again, do we have the capacity to increase testing in Nigeria? I would say for sure we do, because we are told we've got 27 laboratories, molecular laboratories across the entire federation. Then when it comes to increased capacity, this includes the machines. Like I said, we've got that. Test kits. Now for test kits, that's a huge challenge, not just for Nigeria or Africa, it's more like globally. So basically, if you do not have the required test kit like RNA extraction kits, cDNA kits, and what have you, even the enzymes for your final qPCR, if you do not have them, then you have a serious challenge. And again, do we have the sample swaps? That is another issue entirely. And recently I had a member of the government saying that you need to collect your samples properly for you to get onto your test analysis. Again, how long does it take to transport samples from Sokoto to the nearest laboratory? How viable is your RNA? Is it stable after 48 or 3 days? I had most times some samples get to the lab 3 days and they could wait longer before they get onto the machine and all that. So would that lead to false negative results? Be the one to answer. Now, again, do we have the required human capacity? This is something different entirely. The way I will explain this right now is like my favorite boxer is Anthony Joshua. Maybe with very tie anyway. So imagine going onto the ring with Anthony Joshua, and I'm practicing how to become a professional boxer in a live match of the WBA, IBF, IBO, or the bets. Imagine what Anthony would do to me on that ring. He's going to beat me blue, black, and red, because I'm trying to learn how to box, how to move, how to do the jab, how to give the uppercut and all. So that's exactly what we have right now. Do we really have the human capacity to run against this virus? The answer is we are not really there. We are training on the go and on the job. Now, when it comes to testing, I've been into molecular biology for 6 years. And in that 6 years, I've been into molecular neuroscience for 4 years in that 6 years. And I know the level of work that is required to do RNA extraction, to do the cDNA, move on to your qPCR. It takes lots of work. Now, when it comes to the qPCR itself, you need to load the plates if you want to do the standard normal qPCR manually with your finger and your pipette. And to load a 384 well plate, for me, at my speed, usually takes me about 2 hours. At my speed, when I mean speed now, optimum concentration, 2 hours to load a 384 well plate. So imagine individuals you're training on the job, how slow they will be. So again, we do have the capacity when it comes to machine, but for the human capacity, I think we're lacking in that area. Fine, we're training people at the moment, but we're not going to hit that speed we're looking for. Now, are these scientists or laboratory experts taking steps correctly? That's a different question entirely. Do we have the required reagent kits in the country? Remember that the current supply chain says that no country can have more than 25% of their demand. So you have a population of 200 million people. So what is 25% of 200 million? And how many reagents can you get per time? Again, that is a bottleneck. Now, I like to throw this question to you. Do we all think that we need to rethink our testing strategy? For me, the answer is yes. For some persons in the government, the answer is no. But going forward, I will explain why I think the answer is yes when it comes to rethinking our testing strategy. Again, if you want to rethink your testing strategy, it means that we need to run on 2 fronts. The first front is individual testing in areas designated as epicenters, and pool testing for areas or states that are designated with less infection rate, let's say 1 to 5%. So in these areas, we could actually do pool testing. Going forward, you could see that from what we are doing at the moment, we're doing single individual testing. So far, as at this date, 26th of May, we've done roughly 48,544. Now, again, we're told that we could do 2,500 tests per day. You could see we've never, in the last 3 months, hit 2,000 tests per day. As we speak, you could see as at this particular date, which is 25th/26th, we did barely 1,741. That is where we are, and this is the number of confirmed cases we have at the moment. Then again, when you look at this particular graph here, these are all NCDC data, they are not mine. So this is the general fact sheets, okay? And you can see here, what they're trying to explain here is the fact that we've got, I think we've got 27 laboratories already. Now, each state, you could see that this is cumulative anyway. For Lagos, we've got roughly, I think, active cases now, 3,051, but cumulative, we've got initially 3,756. That's as at the time I got this data. Now, when you look far right here, you see days last reported. Take a look at Benue. So in the last 10 days, these guys, I don't know what they're doing. In the last a day ago, Anambra, see where they are. The last time they reported was a day ago. Then these guys also, Taraba, 6 days, 3 days, 6 days. So our level of testing, basically, we're not consistent in that. That's why today we report, let's say 300 confirmed cases. Tomorrow we report 150, next tomorrow 80, just like that. This flip-flop approach of our results is based on our testing strategy and capacity. Now again, moving forward again, I was so happy when NCDC came on board to release this data. They are really crucial. Now, if you look at Lagos, total tests done so far, they've done 17,907. From the data I have, the population of Lagos State is 17.5 million. So 17.5 million into total test of 17,000, we're barely doing nothing yet. And if you do a percentage of positive cases for Lagos based on this particular data, at every single time you run a test in Lagos, 21%, at 21%, you're going to have a positive case. Again, rethinking the testing strategy involves that, like I said before, you need to have a two-way strategy. And that strategy means that the areas that are designated as epicenter, even within states, should go on individual. But areas that are not epicenters, you could say, do pool testing. Now, these data we have, they are not strong enough for us to make viable conclusion going forward in the country, because we have 205 million people as we speak, based on United Nations figure, 205 million people. And in 205 million people, we've done 48,000. We've not done 50,000. And there's a tweet I did a couple of weeks ago where I said, in the next 3 months, Nigeria will barely crack 60. And it's like my tweet is coming to reality just as we speak. So basically, with these figures, can we actually say we have the infection under control, or we're actually moving against coronavirus? I don't know where we are. And I think the only way to fight this jet flight is to test rapidly and aggressively. Now, what is pool testing, basically? I think